This year, the American Pain Society held its annual meeting in Vancouver, British Columbia. Participants came from around the world to hear presentations given by internationally renowned pain experts. The chairs of the 6 sessions featured in this CD-ROM were asked to describe the highlights of their sessions, the messages they hoped their audience would walk away with, and the global view on their respective topic. Doctors David Biondi and Peter Watson talked about the highlights of their sessions.
Migraine pain is the same as any other type of pain. That we have activation of nerves from inflammation, and then we have sensitization and activation of pain pathways in the central nervous system. And because of that, it has a major impact on how we treat the migraine.
Today's session is about antidepressant drugs, which also have an independent pain-relieving effect in certain types of chronic pain, particularly nerve injury pain, such as shingles pain, diabetic neuropathy pain, phantom limb pain, and many other kinds of pain where the nervous system is damaged.
Doctors Biondi and Watson were also asked to discuss some of the key messages from their respective sessions. Dr. Sandra Kama, Donald Price, and James Eisenack also shared the key messages of their presentations.
If we can identify risk factors, people early on in their lives who have migraine, those people that might be at risk for developing a more chronic form of migraine.
Antidepressants are still a standard therapy for this type of pain. There's not good evidence that the newer drugs are any better. They're cheaper, and there's evidence they're just as effective. And there's not good evidence that they have the serious side effects that that has been suggested for them.
Substance abuse, in particular with opiates, is restricted to a fairly narrow population of people, and that most individuals, particularly those in pain, won't necessarily abuse opiates. And so hopefully they'll understand that, it's okay to prescribe opiates as needed to patients who are in pain.
The most important message is that pain is multidimensional, and multiple types of treatments are needed to target these dimensions, particularly in chronic pain patients.
We focus all of our energies on chronic pain and its treatment and its suffering, but it comes from somewhere, and that somewhere often is an acute pain. And we often know when that's going to occur or are present immediately thereafter. So trauma, whether it's surgery or labor, are the 2 areas I'm interested in, can cause chronic pain, and it's important for us to understand how that happens, the genetics of the person as it relates to their chance of having chronic pain, as well as the ways that we can treat it better.
Dr. Price also shared his opinion on the global view of the dimensions of pain and suffering, while Dr. Kama gave her perspective on the global view of opioid abuse liability. Dr. Jeffrey Katz shared his outlook on the global aspect of the role of cyclooxygenase in pain.
I think the global view on this topic from both an American and Canadian perspective is that pain is multidimensional, requires multiple treatments, and is represented by multiple pathways and brain regions.
I think the global aspect of this symposium is that these issues related to substance abuse of opiates is common across all different societies, and so the information that is provided here will be common across different countries.
The global view is the same as the view for Canada and the United States. Pain is a global topic, and the physiology of pain needs to be recognized globally. These applications can be taken anywhere in the world.
Dr. Katz also touched upon what he hoped the APS delegates would learn from his session.
It is my hope that the APS delegates will take home the important information that COX-2 plays a major and predominant role in central pain physiology. It is also my hope that they'll understand that the nonsteroidal anti-inflammatory drugs, as well as the COX-2 inhibitors, while having a peripheral mechanism of action for analgesia, primarily have a central mechanism of analgesic action as well.
Attendees Kelly Thorsdatt and Arnold Weil were asked to share their impressions of the Congress.
Well, I love coming to the Pain Society conferences. I think it's incredible that the American and Canadian come together, because I think you get just a broader perspective from both the United States and Canada. And I come from a pediatric background, so for me there was an initial pediatric pain forum on the Thursday, which was outstanding. The research that's coming out for pain research and clinical outcomes in the pain arena for pediatrics is great quality. So this conference is just high quality, great presenters, great researchers, and the exhibits and poster sessions are also tremendous quality as well.
The seminar is excellent and found the program is very informative, and it's been a nice opportunity to also network amongst peers and see what other people are doing.